Take the intercrust of the tibia, right here. Take the fibula.
You got one?
Right here. And you take the intercrust of the fibula and the intercrust of the tibia, and you go right between them. 12 centimeters proximal to the fibula, where it's usually an average patient. She's a little taller than average. So you go right between them, and that's a perfect place to be. This is where the it's be down here, but the superficial peroneal nerve is coming out right about here, maybe. And so, this is a perfect place to be for every which angle. Okay, this is good. She's good. You can send me this, right?
Mm-hmm.
Okay, good. So, and then give me a measure. Here we go. This is the right way.
Dr. Brady, how many cc's would you like?
Do you want me to record that?
Give me 10.
Won't make people sick here.
Yeah, so let's just say 12. So take the neck of the fibular malleolus and go 12 centimeters up, and this would be it right here. So that's about where the superficial peroneal nerve comes out, and that is exactly where you got to be a little bit above that, but this is where you're going to do the fasciotomy from. To do the measurement, you want to be a little bit above that, but you want to do the fasciotomy right there. So that's great. And then you just take a, so let's take the other side. And I'll have a large blood here.
On the wall, some large
Can you get me a, okay, who wants to do this? Do you want Carly to do? It doesn't matter, whichever you're.
Whoever wants to. You want to.
Okay. This is where everybody might be able to at least feel a fascial poke. It's just nice to. It's not. They don't have to kill you, so it's okay. Yeah.
I'm not worried. Just don't damage my nerve.
I'd be more worried than you think. No. Yeah.
So most people don't know how to do, or know that the two fascial compartments converge there. Is that what you were saying?
Right. Yeah. Exactly. Yeah. And you can go right in here, and you can go right into every compartment. If you stay perfectly parallel to the medial side of the tibia, you'll get through all the compartments in one shot. Posterior,
So
medial.
then can you then expand it all
You can.
the
You
way
do the first
along?
fasciotomy. That's what you do. I go through. This is my incision for a fasciotomy here. It's right here. I mean, it's not a very big incision.
Really?
And then I just use a fasciotome to go up, fasciotome to go down. Yeah.
Okay.
You don't have to.
So you
because
don't
people,
splay the whole leg
I don't,
open?
I don't. I do in that ankle fracture, I do, because I have too much bleeding to evacuate. But my normal fasciotomies, particularly with exertional compartment, you can use a very small incision, because cosmesis is still important to the, it's more common in females anyway, so slightly, so it's, but young females, they're worried about that, so, yeah, it's good. Okay, here's that, okay. Here's that. The way to do that is, so, here's what you do, Carly. So, we'll go here to do the measurement. So all you do is you put a little bit below the skin, then you flood the area, and then you go through the fascia. When you go through the fascia, you'll feel the poke through the fascia. It's just, another 1.5 centimeters down. It's all yours. Get rid of that. Yeah, little gauze there. Yeah. Stop the bleeding before it starts. And this is a little safer area than this. This is right where the nerves come out, so this is sort of protected a bit, usually. Hopefully, a little bit. And just lay a wheel under the skin, because you're going to have to go in with this big needle in a minute. And then just go straight up and down. It'll be less painful. Yeah. You don't have much pain though, do you? Yeah, pretty good. And then did you feel it poke the fascia?
No.
Okay. Mind if I take that from you for a second?
Sure.
Yeah, sure. Just a second. You don't feel me doing this, do you? That's it right there. So let me just see something. Yeah, okay. You just went through. So hers is fairly subtle. This is sharp, small needle, so when you go through, you'll know it.
Yeah, I do.
Did you feel it? Okay, good. Yeah, you're right on top of the artery.
Be screaming my head off right now. I had to fit my hands and numb to my toe.
I was like, this is just another day. I did this to myself last night.
You're probably okay.
Like a pro. What?
I want to show you how to set this up. Okay? So now you take this, and this is the syringe. Hold that. This is the unit. Needle. Oh, wait, maybe we should check the expiration date. Just make sure.
You don't care, do you?
14. Yeah, we're okay.
Cool.
Make sure. Government, you never know. So what you do is you put this down just like that. You get it? And then you're just going to put that needle, that syringe right on top of that. You just twist it so that it's about, and what you really want to get is you want to get this to not be in the way when you snap this in. So I kind of like to tighten that down, push this in here so that bladder is engaged. Looks good. Looks safe. You got it. Now we'll just put the needle on. You'll be all set. So now, another alcohol wipe in a second. This is a sizable needle. Don't be intimidated, okay? See what I mean? Now you do everything you normally do. Just make sure. You turn it on. You wait till this zeroes out. And, okay, it's on 2. So now we're going to zero it. Got it? So now it's 0. So it's ready to go. What haven't we done? One thing you want to do is you want to get a little wheel up there. You don't want to inject air. So you just want to get a little bit of saline. See it all go through? Fills the bladder. Goes up, right?
Yep.
Pretty easy to tell. Go all the way through to the top. Okay? You're fine now. So now you're ready to go. What you're going to do is you're going to inject half a cc to a cc in each compartment.
Okay.
Yes, you have to re-zero after each. You don't have to.
Now you've shown 6.
Yeah, no, it goes back to 0. You don't have to re-zero that at all. But what you're going to do is you're going to run out of, if you went through 4 compartments, you'd run out of saline. You just replace the saline.
Okay.
Got it?
Yep.
Okay. That's all yours. No, wait. Gotta sponge this off. You know what I mean? And you got to see that same site, right? Yeah, and you should be numb. So, hopefully.
Should be.
Go straight in. Go straight in. And look at me. Angle it slightly that way. Slightly the other way.
Other way?
Slightly that way.
The
As if her leg on this
angle
plane,
of the
you were trying to
tibia.
go in perfectly in 90. You get it,
Mm-hmm.
Carly?
Yep.
Tilt that just a little more for me. Make
And
it
a little
just
bit
like
more.
that. Fair enough?
Yes.
Okay, good. Now go ahead. Now don't do anything when you go through the subcutaneous fat. You just wait till you feel that same fascial penetration, about 1.5 centimeters down. Okay? That was it.
Mm-hmm.
Perfect. Now inject half a cc. Look at half cc, and then read the reading on there after you inject half a cc. Inject a little bit more. It looked like that was only about. Okay, that's good. Now let go. Now when that stops going down, you've got the compartmental reading. You get it?
Okay.
So you're just doing it. When it stops for about 5 to 7 seconds, you're probably okay. See how it goes? It changes rapidly now. And sort of it'll just do this for a while. Just ride. Don't move the needle. Just look at the reading. And eventually it kind of stops. It's got a long way to go. It's good. It's just sort of centering out right now. But it's hanging in there. So, and this is a perfectly normal read. So people say over 30, it's perfectly normal to have people who have 30 as a normal read. I mean, that's not what it is exactly, but I'm just saying, don't be alarmed by that. That's not, it is not abnormal.
Yeah, what's the read?
It's,
Hers is hanging, it's below 30, it's right about 30 now, but it's still going down. I'm just saying, a lot of times you'll take it, especially with exertional compartment syndrome, you're taking it for a reason. Exertional compartment syndrome in a teenager these things are high, these values are very 50. And they're high when they're resting, and then they go run, and it comes and it gets up higher. But that's nothing to be alarmed about. They can be asymptomatic at that level. So it's different in an acute situation where it's 25 one minute and 35 the next than when it's 30 1 minute and it goes down to 26 the next. Do you understand? So you can't get too panicky about that. Yeah. You're hanging right in there at about 30, 29, 30. And so it's still going down, but you are getting close, you know, to where this is your normal reading is, you know, not pathologic, but it's up there in the upper 20s, you know. So now we're going to give you a run, and we're going to see if it goes up or down.
I don't know if I can run with a numb leg.
Yeah, you'd be surprised.
I think you'll be okay.
Because it is like.
On your entire foot, yes.
Drive home, does it?
Oh, it does, but it feels like.
You doing all right?
Yeah.
Let me just show you something. I'd like you to stay on that same angle and twist that way to read it, okay? So you don't keep stretching that
Yeah.
skin. I just don't like that. If you stretch, you'll get a little bruise out of that. Be careful. Just see something. Reading this upside down. Yeah. Yeah, when it holds and doesn't make any change for about 5 to 7 seconds, you're probably okay. It's getting close. It's right about 29, isn't it?
Mm-hmm.
Yeah, that's what we got. That's what we got. That's not unusual for this stage. And it's not pathologic at all. Okay, fair enough. So you know how to do that. So all everybody has to know is how to get through that fascia. And that's a feel that just takes, you know, a little bit of a touch. So that's the only thing that's tricky about it. Now the next thing you do is go through the rest of the fascia, you know, layers. You go through the next layer of fascia, and you're into the medial compartment if you go at that angle. And you're in the posterior compartment if you go further down at that angle. Yeah.
Where do you want me to take it?
Well, you didn't inject it. You didn't know enough
So
yet.
don't take it anywhere.
That's a big deal. That's a big deal. So you don't want to really challenge that. Just go for it. You're 29. That's actually what a reading is. That's fine. You're done. So, and what you know, but in each compartment you'd inject another half cc to cc of saline. Okay. That's it. Yeah. You can pull that out, and I'll get this. I'll throw it away. God. Anybody want to? Anybody want to feel that fascia? Are you guys okay? You think you know? I think you'll know.
It's numb. Go ahead.
You guys okay? Yeah, no, you all know. You all know. Yeah, you guys know. Okay, no problem. Nobody's.
I think the going over